Hi, Dave with Align Therapy here. We're going to talk about palpation with scoliosis. It's a common thing in physical therapy when we do an evaluation to palpate the spine, not just for scoliosis, but for pretty much any problem. Palpation is a really big part of our assessment. So today's Strat here is going to help me demonstrate how we palpate the spine. One good thing about Strat, he's pretty ripped, but we can see his spine really well. So that's what we're looking at. So Strat, stand right here and face that way for me. So I'm going to have Strat bend forward, and I want you to see right here, he has a right thoracic curve. Let's look down here a little more. Yeah. This side is a little higher than this side because it's rotated back on this side and forward on this side. He also has a lumbar curve, which has actually gone down as we've been working with that, as he's been braced. But up here, if we look a little higher here, this side is higher than this side because he has a left upper thoracic curve. So all those things indicate that we have scoliosis. Stand back up for me. So now stay there and don't wiggle. He has a little bit of a pelvic imbalance. His pelvis shifts to the right and his trunk shifts to the left just a little bit. That's because of that lower lumbar curve. So all those things, as we're doing a physical assessment, tell us that there's something going on. His shoulder blades are a little, if you would relax and stop wiggling, you can see his shoulder blades are off just a little bit. His left shoulder sits a little higher than the right shoulder. Again, all those things are just signs that there's an imbalance or an asymmetry in the spine. So that's our standing assessment. So now let's look. Strat, go and lay on the table, facing the face fold, take a little nap, arms down by your sides, straighten out your body a little bit. There we go. So with him just laying like that, so one thing that we do is we palpate right along the spinous process. So the spinous process is the knob that's on the back side of the spine. So I'll usually use my thumbs and just palpate down the spinous process. So if we come a little closer, as I palpate his spinous process, we do see on Strat that there's a curve that goes to the left. You can see the white after I move my fingers. I don't know if you can see that very well, but you can see that that curve goes to the left. As we come down here in the thoracic, we also see that his curve goes, I'm just going to do that, his curve kind of goes to the right side. As we come down into the lumbar, it's very straight, and so you don't see as much of a scoliosis curve there. So Strat's a little bit abnormal. Normally we don't see, on palpation, we can't see exactly where those curves are. The reason is because of the rotation that we saw when he bent forward. So if we take this spine here and we lay it on Strat, that's a little big for him actually. Oh. So if we think about the rotation, let's think about this thoracic curve that's right here. His spine is rotated this way and it's curved this way. So that rotation, like this, brings the ribs back on the right side. And that's how we notice it when he bent forward. But it also takes these spinous processes and that rotation brings them back towards the midline. So even though we have a curve that goes to the right, the further we get into that curve, the more rotated the spine is, and the more that spinous process moves to the midline. So most of the time, Strat is the exception, most of the time as we palpate the spinous process, the spine looks fairly straight, even though someone may have a significant scoliosis curve. So keep that in mind. If you are seeing that that's straight, but when they bent forward, you're still seeing a rotation in the ribs, chances are they still have scoliosis. You're just palpating the spine that's rotated towards midline, and you're not seeing it as well. So if I'm palpating someone's back, I'm not going off of that palpation to tell where their scoliosis is. I'm using their forward bend test to tell me basically where the curve is, and I'm palpating the spine to see if I do see a deviation in the spinous process. The other thing I'm doing is I'm looking to see if there is a rotation in the spine. So with Strat, it's kind of hard to see on a video, but with Strat, this right side is back and the left side is forward here in the thoracic spine. In the lumbar spine, it looks great, but in the thoracic spine, we see that rotation just slightly. I think the reason we can see Strat's curve so well with his spinous process is because he doesn't have as much rotation as we normally see in scoliosis patients. Normally, if we were seeing a curve in the thoracic spine like this, we would be seeing more rotation.
Wait, like, what's the normal degree for rotation?
There's no normal degree of rotation. Everyone's different. But anything over 5 degrees, 5 to 7 degrees of rotation is a normal rotation. Well, normal for scoliosis.
Wait, but what do I have?
What do you have? I'd have to grab something to measure it. But
isn't it like 11?
I think we were at about 11. So when he bends forward, we actually see more of a rotation. But when he's just laying here like this, we're not seeing a ton of rotation. And so the spinous process lays a little bit more lateral. So you can check the mobility of the spine. I feel like you're squeezing them to death here. And palpation is an important part of assessing scoliosis, but it's not the only thing that we look at. We have to take everything together as the picture to tell what we're looking at. So a little bit of information on palpation. Hopefully that helps you understand what you're doing as you go to a physical therapist to get this looked at. Or maybe a physical therapist who looks at scoliosis sees this, and hopefully you're learning some palpation techniques. So thanks for watching. Thanks Strat for helping me out. And if you want to learn more, we're here for you. Go to our website or watch some of our other videos. Thanks.